Hello, today I'm going to talk about rate control versus rhythm control for atrial fibrillation after cardiac surgery. Definition: atrial fibrillation, also called AF, is a quivering or irregular heartbeat, arrhythmia. This irregular heart rhythm can lead to symptoms that negatively impact the quality of life in some people. Others experience no symptoms at all.
Alright friends, today let us discuss atrial fibrillation. Atria means upper chamber of the heart. Fibrillation means irregular contraction. This is a very common heart arrhythmia problem where the upper chambers or the atria are contracting very irregularly and at a very fast rate, whereas the lower chambers are going at a normal rate. Why should one be concerned about this? Because it gives rise to symptoms such as heart palpitations or passing out or shortness of breath, chest pain, etc. This is also very important from another point of view, that is stroke. When the heart muscle is not contracting properly, the blood flow is disturbed, there is stagnation of blood, and when there is stagnation of blood, the result would be a blood clot. So the upper chamber will develop a blood clot which can go to the brain and cause stroke.
Mechanism: the irregular atrial discharge, typically of AF, may result from an irregular atrial response to a rapidly discharging, regularly firing driver resulting from either local ectopic firing or a single localized reentry circuit. The focus of a rapid ectopic activity is often located in muscular sleeves that extend from the left atrium into the proximal parts of the pulmonary veins. AF in itself can cause progressive changes in atrial electrophysiology, such as substantial refractory period shortening, which further facilitates perpetuation of the arrhythmia.
Mark Scott may be retired, but that doesn't mean he's slowed down any. He's an exercise buff and loves music.
I enjoy music and enjoy just living life.
Mark taught music in public schools for 38 years, but lately it's the beat of his heart that he's been dealing with. Mark has atrial fibrillation, or AFib, and he's not alone.
So atrial fibrillation is one of the most common arrhythmias in humans. It occurs when the top chambers of the heart, instead of beating a normal 60 to 100 times a minute, kind of go haywire and beat between 300 and 400 times a minute. Instead of contracting or squeezing, they begin to quiver or fibrillate, thereby causing your heart to beat rapidly and irregularly.
AFib affects nearly 3 million Americans. By 2050, the number is expected to jump to 8 million. People with AFib are 2 times more likely to be admitted to the hospital and 5 times more likely to have a stroke.
Because the heart is quivering, blood can actually clot in the heart and then dislodge and travel to the brain, causing often devastating strokes.
Rate control. Rate control is achieved with medications that work by increasing the degree of block at the level of the AV node, decreasing the number of impulses that conduct into the ventricles. We can use beta blockers such as metoprolol, atenolol, bisoprolol, or nebivolol. We can also use non-dihydropyridine calcium channel blockers or cardiac glucosides like digoxins that have less use in older people who are sedentary.
Atrial fibrillation is and always has been the most common complication after cardiac surgery. The controversy about how best to treat postoperative atrial fibrillation has not been addressed in a big randomized control trial until now. The Cardiothoracic Surgical Trials Network conducted a study comparing rate control to rhythm control in people who develop atrial fibrillation after cardiac surgery. Rate control was achieved primarily with beta blockers, rhythm control with amiodarone with or without cardioversion. The primary endpoint of the study was the number of days in hospital from the data randomization till 60 days post-randomization. Therefore, this endpoint included readmission. The trial finding was that rate control and rhythm control were equal for postoperative atrial fibrillation.
Rhythm control. This consists in the restoration of the sinus rhythm with regularization of the heart's rhythm, improving cardiac hemodynamics and exercise tolerance. This can be electric cardiovation, and electric shock is delivered to the heart through paddles or patches placed on the chest. Cardioversion with drugs. We can use antiarrhythmic drugs to help restore normal sinus rhythm like amiodarone, propafenone, and flecainamide. Before cardioversion, the patient may be given warfarin for several weeks to reduce risk of blood clots and a stroke.
My name is Kate Kudlachek, and I was diagnosed with atrial fibrillation when I was 43 years old. My husband and I were very active in everything we did in our lives, very active with work, very active in the community. We'd like to travel a lot, we like to be outdoors and do a lot of things outdoors. The atrial fibrillation really changed that for me.
Atrial fibrillation is the most common electrical problem that people will develop. It's associated with a chaotic electrical rhythm in the top chambers of the heart, and the result is that the heart rate is accelerated and irregular. The performance of the heart is diminished.
My atrial fibrillation started by just feeling kind of a blip, a real rapid heartbeat and a regular heartbeat, and only maybe for just a few seconds. It got to be a little bit worse as far as lasting for a longer period of time. I would have these episodes where I could feel my heart beating irregularly for anywhere up to 4 to 6 hours every day. And it was both physically and mentally draining for me. It was hard to concentrate, hard to do anything.
You can think of it as if your heart is trying to run a marathon day after day. So you feel like you've run a marathon even though you've gone about your daily activities normally. And I think in Kay's case, the lightheadedness and headache were major complications of the problem.
Conclusion. In the study of strategies of treatment, atrial fibrillation occurred in 33% of postoperative patients. They compared the rate and the rhythm therapy, and they found that the patients were associated with equal numbers of days of hospitalization, similar complication rates like thromboembolic and bleeding events, and both patients had a stable rhythm without atrial fibrillation, showing neither treatment strategy showed a net clinical advantage over the other.
Mike Leahy loves being active and getting outdoors, but lately that's become more difficult. In fact, Leahy started having episodes where his heart would beat really fast. One time it got as high as 200 beats a minute, and he wasn't sure why.
I discovered through my family doctor I had a strange blip on EKG, and he sent me to my cardiologist, who discovered after monitoring that I had a slight case of AFib.
Atrial fibrillation is a condition where the heart beats rapidly in an irregular way. It can make you feel like you've just run a marathon, all while standing still. It can also make you more likely to have a stroke and heart failure. AFib is the most common type of abnormal heart rhythm. Millions of Americans have it.
It just leads to further damage to your heart and scarring.
Leahy is having a relatively new procedure doctors call cryoablation. Doctors navigate a catheter from the groin into the left atrium of the heart and use extremely cold energy, or freezing, to create a circular scar that separates the muscle fibers causing AFib.
The nice thing about this particular procedure, it's a balloon, so we position balloon in the orifice of the veins, and it's a much quicker approach. And the results are excellent. The long-term outcome is excellent. So far we've been using this for several months now. It's been very successful.